Hobbs. I'm the Director of Research and Innovation here at Trinity, and we're delighted to have this event as an effort to showcase to you the great technology transfer activity we have in the university. And just to give you some numbers, over the last 3 or 4 years, we've had over 100 licenses of our technology. We've had over nearly 500 collaborative agreements with industry and over 17 spin-outs.
So despite all this beautiful old university we see here and lovely portraits of British monarchs and everything lovely in Front Square, this is a university where great science happens, where great engineering happens, and where great technology is invented and commercialised.
First of all, I want Matt Campbell to come up. Round of applause for Matt. Matt works on the eye and the brain, those two very important organs. And our second guest is O Keeffe. Round of applause for Lucy. Lucy works on the heart, very important organ. And then probably the most important organ for a man of my age, the prostate. We have Conor Harkin as well. And then from my own story briefly, I'm in biochemistry, by the way. I'm a professor of biochemistry in the School of Biochemistry and Immunology in the Biomedical Sciences Institute. And I've always been involved in commercialization myself. And the main reason is, of course, if you make a discovery in your lab, of course you want to make it meaningful, okay? It's all very well to publish a fancy paper, and that is rewarding, I'm not saying it's not. Or give talks at conferences and educate our students, that's all wonderful. But imagine if you make a discovery that could be useful. How do you make your discovery useful? You have to commercialise, that's the only way to do it. And you might do a license, you might involve a big drug company. In my case, my first ever license actually was with AstraZeneca. Back in 1993, we discovered something in my lab, did a license with AstraZeneca. They funded a postdoc in my lab for 4 years, and that was my first encounter, I guess, with the commercial aspects. And then I began to get more and more IP from my work. And then in 2003, I was approached by a guy called Mark Heffernan, who was an Australian guy, and he said, "Luke, I can form a company around your IP." And I said, "Fantastic." And me and 2 colleagues, Dermot Kelleher and Kingston Mills, our IP combined, Mark had raised money, and he went and raised, I think, initially 4 million, and that was Opsona. But Opsona's going strong still. And then the next company then was Inflazone, and that began, I think, 2 years ago now. And again, that was a discovery in my lab in Trinity. One of my graduate students made a very important discovery. And I began to collaborate with an Australian called Matt Cooper, who was in the University of Queensland. And between us then, we became founders of Inflazone. And again, we've raised so far about 5-6 million, I guess, is the initial amount that's come in. We're looking at a 20 million A round. We're just beginning, it's about 1.5 years in now. That was my second company. And the third one then, amazingly, began, I guess, about 6 months ago now. I did a sabbatical in GSK in 2016. And that was interesting because they enticed me to go to Stevenage in the UK and help them with their immunology program. And they want to bring academics in, by the way, because academics have new ideas and they can be very dynamic and bring a frontier into a big pharma. On the back of that then, they licensed technology from my work in GSK into a new company, Citrix. And I became a founder of Citrix, and that began 6 months ago. It's about to be publicly announced in the coming weeks. And we've raised 28 million so far from venture capital to get Citrix going. So there's 3 examples. I mean, to me it's a surprise, of course, that I'm a founder of 3 separate spin-outs. But again, it's a testament to what Trinity's all about in a way. Because these were very complex things to do. The contracts were complicated, the licensing was complicated, and Trinity was extremely supportive of my efforts in that regard. And so those 3 companies are now up and running, and let's hope they continue. So if you don't mind, tell us who you are and what you do in your day job, if you like, and then about your commercial activity and your spin-out or whatever it might be. So you go first.
So my name is Matthew Campbell. I'm a lecturer in genetics, and I also run a research lab here in the Department of Genetics. So we currently have 8 people working in the lab, a mixture of postdocs and PhD students. And in the past 12 months, we have spun out a company. It's a Trinity campus company called Junction Therapeutics. And it's actually very similar to what Luke has mentioned, that he was approached by an entrepreneur to do this. And it's almost the exact same as me, that I was approached by this guy who wanted to set up a company. And the idea, to me, it seemed like a no-brainer that, we had an IP portfolio that was very, very strong, where patents were filed and also granted. And the focus of the company essentially is on enhancing drug delivery to the brain. So 98% of small, low molecular weight drugs simply can't get access to the brain if they're administered as an oral medication or systemically. And what our technology ultimately does is it allows for enhanced drug delivery. So it's sort of a platform company, platform research company, but what we're trying to do is develop a novel drug delivery system for glioblastoma multiforme, which is a type of brain cancer. And so we have clinical trials planned. We're currently in Series A fundraising, and we have 2 VCs that we hope to close in the next 2 to 3 months to get the clinical trial initiated.
Very good, thank you very much, Matt. Now, Lucy.
Hi, so my name is Lucy O Keeffe. I am the CEO of CroiValve, and we're an early stage medical device company based here in Trinity and looking to, I suppose, imminently spin out. We're a campus company, and we're looking to repair one of the valves in your heart without the need for surgery. So typically heart failure patients who are very ill have issues with their heart, and the heart stops functioning correctly. They're too ill for surgery, so we're looking to provide them a suitable treatment option that's minimally invasive and doesn't require surgery. In terms of, so my background, I'm a degree in PhD in engineering, but effectively spent my whole career kind of leading medical device development projects in multinationals. So we're probably a bit of an unusual story in terms of how we came to Trinity. To be fair, it's probably due to Professor Smurfit, who's here this evening. So the idea behind the CroiValve concept came from Dr. Martin Quinn, who's an interventional cardiologist here in Dublin. He was always, I suppose he sees the clinical need every day with patients, and he very much was an avid innovator in seeing new and better ways to solve some of these problems. So he had been inventing and patenting devices actually for years, but patented this concept back in 2014. He was looking for a way to take it from that kind of idea on the page into reality, and was lucky enough to get introduced to Bruce Murphy, who was also doing actually early stage valve development work here in Trinity. So together, I suppose they got some funding from Enterprise Ireland to develop this technology, contingent on finding an experienced team. So actually that's been myself and Bruce's paths had crossed previously during my PhD, and he reached out to see if it was something I was interested in. And at the time, it just happened to be particularly fortuitous, where I had suddenly decided that I'd had enough of multinationals and wanted to take the leap into startups. So possibly a year before, I would have said, no, that's way too risky, whereas the timing was just right. And so I met Bruce, met Martin, who's the cardiologist, and then Paul Heenan's our fourth founder. So we kind of, I suppose, kicked this off in 2016 here in Trinity, and have done, I suppose, extensive development, and now looking to kind of close our seed round and take this further. It's obviously a class 3 medical device, so a long development journey, but yeah.
Was that tricky, Lucy, to transition from multinational into a Trinity small startup company? What was that like?
Yeah, theoretically, I mean,
You're very brave, obviously, right?
I possibly reacted or responded probably better than people might have thought. Yeah, it was certainly a change in terms of, I mean, I think I commented earlier that I'm now based in one of the labs here in Trinity, which, while it actually achieves a huge amount of impressive work, is not necessarily visually, to be a quarter the size of this room. And so, to kind of go from, lovely offices and, 15 people below you can delegate things to kind of get based in this little lab with way less resources.
And you have to do everything.
I have to do everything, yeah. And some of the administration elements within Trinity and the time they take, I think, there's a few elements where I'm not used to the timelines of those, and I don't have the patience for it. So it has been, that side of things, there has been some learnings, but truthfully, actually, it's a great team who are really focused on an important unmet need, and so that's really the most important thing, and all the rest of the stuff you can kind of, to a certain degree, let the thing about that.
So Proverum is a device for a thing called benign prostate hyperplasia, which is an enlargement of the prostate gland. A lot of men, as they get older, this gland blocks off the water passage and up 3 or 4 times per night, and difficulty urination with urination. So I'm similar to Lucy in a way that I came into Journey via a connection with Bruce Murphy. There's now 8 of us this year. We were delighted to close a funding round just in December of 3.5 million, led by Atlantic Bridge, which is a Trinity link there as well, because they have a dedicated fund for spin-outs, and a lot of Trinity alumni are amongst our investors as well. And we're heading into the clinic now, so the team's expanded. We needed to get to the level where you can build a product that is graduate, worked in venture capital for a while, Philippe Saroba.
Very good, yes.
I don't know any details about your deals.
Oh, we love Saroba.
This kind of conduit going into the university to do all the early work, and then opening up the network to grow the team. It's really worked out well.
Yeah, I mean, what strikes me, of course, is overall the dream here is very clear. Can you imagine if any of these companies actually succeed? Now, the investors are hopeful that they will, of course, but But the dream here, like if Matt makes a breakthrough there and really benefits patients, the ultimate goal is to benefit patients, let's face it. And in your case, with the heart or whatever, in our case, so we're embarking on a big trial with Opsona and a type of leukemia called myelodysplastic syndrome. We've treated 50 patients, you know. It's a huge thrill if you think about it. And if it works, we're going to be over the moon. Now, we're over the moon for a number of reasons, by the way. One is commercial, clearly, because the investors want to get a return on their investment. But that's actually secondary for me, strange as it may seem. I mean, if we can impact on patients, and there's all the companies in Trinity Tech, you'd agree, have that ultimate prize. And the second thing for us, for me personally, is educational, actually, in a sense, because to show the students and the graduate students we can do this, and inspire them to get involved. Because we are a university, remember, as well. That's the other bit, to me, that really is a big advantage to what we do. And to have people prepared to give us money to try and make our dream come true is what it's all about in that sense. But if we move on, I've got a list of questions, you see. Are you ready? We'll be here for 4 hours, by the way. The doors are now locked, so nobody can leave. There's a load of questions we might ask, and people feel free to interrupt now if you have any questions as we go along. There's a lot of questions come to mind, and obviously the first one is the challenges of all this, right? Now, Matt, I might go back to you again, simply because you're closest to me, but so to be an academic, right, and your day job is to teach the students and educate them and do really world-class research. That's a really difficult thing. Both of those are challenging, okay, let's face it. To do it both well, of course. And now we superimpose on top of that commercialization or entrepreneurship or whatever you want to call it. What do you think is the biggest challenge of that?
I mean, I actually think that the situation that I'm in, and obviously the situation you're in, that you actually have access to a research lab and some of the best PhD students and postdocs, you know, you can actually de-risk projects prior to actually commercialising them. So if the focus is that you want to commercialise something or bring something to clinical trial, which I try to instill in my students and postdocs as well, you know, the ultimate goal is to bring it to clinical trial, and the only way to do that is through the commercial avenue.
Right.
You can actually de-risk projects in your own lab. So all of a sudden you can go to VCs and you've done the animal work. You know, we've had investment from Enterprise Ireland previously for non-human primate work. So EI put up €300,000 for a good laboratory practice GLP study in non-human primates that completely de-risked a product that we were developing in an academic setting. Right. So I do think that we're a little bit luckier in that sense that we have access to that. So I don't think it's necessarily a challenge. I think it's actually a really, really good thing. The challenges are trying to find the right therapeutic target that you're going to try to de-risk.
Right.
You know, I think in academia we're very sensitive to pulling projects that you've invested so much time in, or the PhD students invested so much time in. You know, in industry, if something stops working, that's if you cut it. But in academia, we'll see it and we'll work around it and we'll figure out why isn't it working. We'll make changes. But I don't think industry will allow you the time to do that.
Yeah. Are you a politician, man? You dodged the question there, man. There's no challenges, he said. But let me just get. So you need to go and talk to investors.
Yeah.
Or that's what interests. Not many academics can actually do that. Actually, it's a special skill because most academics they noodle away and they use too much jargon and put the investors off. Right. So I think in my opinion, that's a challenge for academics to be able to go and do that. You know. And how did you crack that in a way? Because obviously you're able.
I think the major thing that I had to learn was trying to disseminate scientific information in an easy manner. You know, you do go and you sit in front of VCs who they're very articulate and they're speaking at a very high level, and it's almost automatic that you think that whatever you say scientifically, they're going to get. Yeah. And in actuality, they're probably exactly the same as the layperson. You know, somebody standing at the bus stop. So, you know, the challenge was to try to break everything down to its most simple level. If you explain it to your granny what you did in the lab today, what your technology was.
He thinks VCs are like your granny corner.
There you go.
What do you make of that? And you've been on the other side of the table. It's a row. I mean, when an academic turned up at your office and had a great idea, I'm sure you saw many of them, and you would have said, well, hang on a minute.
All the life science VCs predominantly are PhDs. I'd say their due diligence is actually very, very thorough. So I do get that to get the message across initially. Yeah. Absolutely, you want to get that in a very compelling, easy way, but quite frankly, the due diligence, as you're aware, it gets very detailed, including picking up the phone to your contemporaries in other universities. Yeah.
But it's a real skill, isn't it? When an academic turns up at Sir or whoever and wants to make a pitch and describe their idea and so on, in my view, having spoken to many VCs, they often fall because it's not coherent, or it's not. In other words, I think there's a real opportunity actually to train academics who want to do it. Isn't it? When you agree to do it right in a way. Would you agree with that?
Absolutely, I suppose, but also if that is an issue, that might be them doing due diligence on said academic about are they the right person to commercialise. Dare say it's a personality thing, or if this person can't get across their research in a compelling, easy way, maybe they're a brilliant researcher, but they're not quite the right person to bring it forward.
But you still need a chief scientist to be able to sell it to the investors, don't you, as well? And,
you do.
And I think that's right. Here's a question for you, Lucy, in a sense. I mean, I've always had the gap in Ireland, and probably in every country, is the entrepreneur who becomes a CEO, you see, because that seems to be difficult, doesn't it, to get a great CEO for companies, because they have a very demanding role. They need to be on top of the science or the engineering or whatever it is as well, and the commercial bit and all that. So those people are kind of unique, and they're very hard to find, I think, in Ireland. Would you agree? Now, you've come in to help your company in a sense, and you had a multinational training and background, so you're obviously well able for it. But do you think the CEO role is where there's a big challenge, basically?
I mean, I think as anyone would say, probably with lots of kind of senior positions, it's always challenging to find the perfect person. Do you know what I mean? Because you're talking about a fairly kind of niche set of skill sets, whether it's probably a CEO or CTO or a number of those key roles. So yeah, I mean, certainly I would say from my own perspective, I have the benefit of a solid engineering training, and then actually kind of within my previous career have led very similar device development projects. So I have a very good understanding of the technology and what's required to get it to market, and then years of experience of kind of the commercialization side of things, leading projects. So for me it's good in terms of having sufficient understanding of multiple touch points. Possibly not needed, and when things get bigger, you can move further away from the technology side of things.
Yeah.
But certainly does help in terms of as with all these projects, it tends to be about risk management and de-risking. So at least when you have a proper understanding of where the potential pitfalls are, you can actually kind of focus your resources there.
Right. Well, just struck me recently, we had a very talented immunologist, because I'm an immunologist, who got top. I won't give his name. He got top of the class this year in his finals. Brilliant guy. And he came to my lab a fair bit, and he didn't want to do a PhD, and he's very entrepreneurial, you see. And I knew within 5 minutes he's got to go and be trained, because it was a bit chaotic and like full marks for enthusiasm, but he missed an awful lot of it, And I think there's a gap for us there in a sense. Now there is the entrepreneur program, as we know, in Trinity, and we're helping the students, but those students need careful mentoring, I think, and careful guidance and encouragement and education almost, And that's where I think we could be very useful to them in a sense, and the alumni might even help with this in a way. Because a certain percent of students, have you seen this, are entrepreneurial, and they really want to do it. And they see someone doing a PhD and a postdoc, and there's no career path, and they don't want to do that, but they're very bright. And I'm wondering how we can help them in a sense, and how we can encourage them to do more of this.
Yeah, I mean, I think a lot of the focus really should be on trying to encourage students to see the big picture.
Yeah.
Because one of the questions that we constantly got asked was, well, how much is this thing going to cost? It's never something I thought about, because I was talking science, and I thought that, if you talk science to these people, they'll understand and they'll be enthused by my brand new discoveries, get really excited about it. But then they were asking, how much is this going to cost compared to what's on the market already? And there are questions that I never even contemplated. Accurate timelines, in clinical trial development, how much is the phase 3 trial going to cost, what's it going to look like? They're all things that seem so far away that you don't want, you're afraid of going near.
But it's a far cry from you making fundamental discoveries about the eye, isn't it? For example.
But in actual fact, when you start talking to the right people, it's all about building a network. If you start talking to the right people, there are answers to those questions, and there's actually pretty accurate answers.
Right.
This will cost this amount because this is what the market's going to look like in 5 years from now. There's ways of getting objective numbers onto it.
Right.
So I think that's really, really important to try to focus the attention of students and postdocs. That's not just about the science. When I was told that at the start, when you talk to these VCs, it's not just about science. Balked at, because science is something that we all, if the science falls down, everything falls down. So I was going in there a little bit aloof, I think, possibly, thinking that it's all about the science. It's all about the science. When in actual fact, it's probably, I don't know what the percentage is, but I think it's maybe 70% not about the science. It's about the bigger picture and what this is going to look like as a product.
Again, I'm harping on a bit about the skill set you need to do what you see, and not many academics can do it, let's face it. A certain percent can. Now, I'm not knocking them because they are great at other things, and we are a community, and it's fantastic. You'd never put some academics in front of a VC for your life, would you? It'd be terrifying, But they can be fantastic at their research, so they're still contributing. But only a small percent can really do this, I think. And then that brings me to the next question in a sense, and given that we were all academics once, is there a clash, do you think, between academia and commercialisation? Does that still exist? Because when I began doing it, some of my colleagues would have frowned on it and would have said, that's outrageous, you're compromising your integrity here. You know, I'm talking to guys with money, it's unacceptable. A lot of negativity, you know. Now that was 15, 20 years ago, I think it's changed. But is that still there, kind of, in your experience? Do you think there's academics are seen as lesser if they get into commercialisation?
Well, I'm going to say that because I'm not necessarily came from a pure academic background, but I really do think it's an artificial divide. Like in my mind, as you articulated earlier, to fundamental science, to get it out there requires commercialization. So it's not a nasty, maybe it's got a kind of attain to trades and sales, you know, it's a nasty thing. It's not pure science, it's not pure discovery.
Yeah.
But if you want to get that product out there, it's going to require that commercial aspect to it as well.
Yeah.
And dare I say, even like the team, 8 of us at the moment, I would say we're doing good science. I mean, it's not going to go in nature, but the team to get to the next level, to get us into the trial, even our validation testing, there's good young engineers there that are doing good science.
Yeah.
It requires a scientific mindset to get out there. And I just don't like. There's room. They all work together. There's room for fundamental science and technology and engineering.
And as I said, I do think it's changed. I mean, as Paddy said, who'd have thought we'd be in the senior common room talking about this? It's with a drone filming us as well. It's unusual. But Lucy, when you came in away from the multinational background into an academic environment, was that a culture shock then, you think?
Yeah, I mean, it's like to a certain degree, I suppose I would see us in Trinity, you know, where there's kind of an incubator, let's say, for us, but you know, we're still very much always looked at it as a commercialization project.
Yeah.
It's never had any sort of anything other than a pure commercialization focus. There is, you know, to Conor's point, a lot of very solid science and engineering that's gone into it and continues to go into it. But you know, there was never a pure research aspect. So from day one, you know, and obviously my background is very much around the timelines and the milestones, budgets, and that's how my brain works anyhow, along with the engineering. So we always looked at that side of things. I suppose a couple of things I'd say. One, maybe to your point about the different skill sets, I think for us and for our project in terms of success, it's really about collaboration.
Yeah.
So like we had 4 founding members who all have very different backgrounds and very different strengths, and that's actually what is the strength of the team, because we're not all bringing the one thing to the team, we're bringing 4 very different parts. So actually then together, even with a small team, we can actually kind of cover off a huge amount of elements. Whereas if you actually get, you know, before maybe pure academic backgrounds, then it'd be kind of different. Whereas I think that bringing different skill sets in is maybe probably one of the big successes. You know, so I suppose in terms of our side of things, you know, we very much always have a commercialization focus. There are, you know, certain elements that I have to learn about in terms of how the cogs of Trinity work. Yeah. And trying to get things to work at the pace I want them to work at. We're all trying to figure that out, and there's a few of those things that I struggle with because I like things to work very fast. But apart from that, that's more of the administrative side of things than the main core aspect.
All right, but I think this is a key question actually for tonight in many ways. I mean, the Trinity part of this and where there are gaps or where it could be better, right? We get the dead rat on the table, as we always say. You know? So if you were to have your company in Stanford, say, or Imperial, would it be different? Now we long to have excellence here in everything, remember, and as scientists in our academic labs, that's the goal, otherwise you won't survive. You know, my academic lab, it's all about competing with the best in the world. And to get a big publication is very difficult to remember, and it's hard. And we do that occasionally, and we're happy with it. The commercialization bit, I'm wondering, are we as good, in a sense? And is it as excellent as it could be? And if it's not as excellent, like we do want to be as good as anybody else, or if not better. And there are unique things about Ireland and Trinity that give us an advantage, by the way, you see. So I'm just wondering if you have any view on that, what you would do differently, or would it be easier for you if we were to transplant you into the West Coast of the US or wherever?
So firstly, I'd say, you know, in terms of, you know, it's interesting, I suppose, myself and Conor have effectively come from the same lab. So actually, you know, what Bruce has managed to set up within the lab is somewhat of an organic ecosystem that actually is effective at, you know, and there's projects that are here that are kind of a year behind us. So that ecosystem itself, where you actually have, you know, someone who's gone before, I ring up Conor to go, right, you know, he's kind of, you know, a couple of years ahead of me and has done certain things that I'm coming to. And so that there's kind of, within the current system that we have, there's an ecosystem, there's sort of an organic ecosystem that doesn't necessarily form a structure that's very helpful. You know, I think I would struggle if let's say, you know, to be fair to Conor, he but you know, that's definitely beneficial. And the more Trinity can do to, let's say, harness that ecosystem and maybe support it, the more companies that have gone forward, and the more there's kind of a track record, then for everything that comes behind, it's easier. So I think that side of things is done well.
Did you notice any blocks or any kind of hurdles that were needless, say, or to make it more difficult than it should have been?
Yeah, there's certain things
you
around.
Speak freely here with our family, alumni together.
So there's certain things around like, you know, administration and grants and contracts and stuff like that. So we got a grant from Europe, and you know, it took 6 months to get the grant signed off. You know, there's certain stuff like that where you're like, that could have been easier.
Right.
You know, that hasn't added any value. The money has added a lot of value. We're spending 6 months trying to get a grant signed off, involving 100 phone calls and 300 emails.
Did you ever say, does it have to be this hard?
Yes. But I mean, I would say, you know, that's not the largest part of the project. The money is very beneficial, and the money wouldn't have come without Trinity's involvement in that partnership. So I recognise the big picture. There is just certain administration things that could be easier, yes.
Right, very good. Yeah. What would you say, Conor? Would you?
I kind of echo that. So it was generally all positive, and in some of those constraints, I agree. So we actually had a kind of a EIT grant as well. So just you know, you got your 50 grand, great. You know, we'll set up. It took a while to set up the account. But that's, I know the research department was working very hard, but it was more even the counterparty in the EU was causing difficulties there and getting that over the line.
Right.
But it's not even Trinity per se. It's just sometimes it's just like
it's systemic,
like public funds. So you know, the tendering thing, like we had to do our trial in a canine model, and we could only pick one lab, IMM in Paris.
Right.
And I had to go out and go through the motion of getting 3 tenders from, you know, almost like make up 2 of it, not make them up. We had to find 2 of the lab, knowing, and even though we knew we could only go to this. So just things like that. But really in the grand scheme of things, it was a little bit of you know, hurdles to jump through from a logistics point of view, but not a big deal.
In my experience, so with Opsona, we had 25 staff at one point working in Trinity, you know, and we had a contract with what was Wyeth, it's now Pfizer. We're paying for 10 FTEs for 5 years, you see, which is great. And that was great to create employment. That was the good part about this. That half of them are postdocs, you know, it's fantastic. And that worked really well, you know. And then Opsona then eventually went clinical. The trials being done outside Ireland, the staff numbers fell, you know. Now, with Inflazone, what was interesting, our CEO, Matt Cooper, came to live in Ireland. He's on kind of a leave of absence from his academic post in Queensland. And he came to Ireland, and Jeremy's over there, I'll point to him in a minute. Jeremy joined the company as well, and we're down to the Enterprise Centre, you know. And then Matt probably was here full time for about 8 months, but he couldn't recruit people. His negative was there wasn't the right talent base, and he wanted very specific senior chemists. And he found them in the UK. And they were ex-Big Pharma, ex-Takeda and ex-Merck, you know, fantastic guys. And then he said, listen, we've got to set up in the UK now because we couldn't recruit here. So recruitment became a hurdle for us in Inflazone, simply because, now I suppose if he tried harder maybe and he'd beat the bushes a bit, but the truth is there's a timeline, he finds great people, he's very pragmatic, you know. And so now Inflazone is partly in Cambridge and partly here, so there's a vibe between the two. And that would have been one barrier that we would have felt, I guess, recruitment, I suppose. And what about you, Matt? Would you identify any barriers or any hurdles that are needless?
Yeah, I mean, there's been plenty of barriers, but it was funny just in your comment about the tendering, because when we got funding to do a GLP study in monkeys, we basically, it's a sensitive subject. I ran with the procurement office and they could fill in the form. It was basically a tendering process to inject 30 monkeys. And he was like, oh, you just go and find a company, you can do it, you know. So it didn't need to go out to the tendering process necessarily, because it was such a divisive topic, you know, you don't want that on the headlines of Trinity, 30 monkeys. So we actually found, you know, they just kind of bent the rules, because they said, you know, you go and find the best company that can do it.
So yet again, you're not answering the question. That was an advantage.
I was fine with you.
I'm hoping for it.
It's not all negative. The question
the elevator's not working, or whatever.
You know, in the earlier days when I was started filing a lot of patents, and we've got like 5 patent portfolios for various different technologies. You know, it was quite difficult in the early days, because you know it was being hammered home to you, the difference between what your job is in Trinity and what you're trying to do in terms of commercial activities, private enterprise. And it was constantly being reinforced that, you know, they're 2 separate things and they can't merge. You know,
and who was reinforced? Who was sort of saying that?
It was just general feedback in Trinity. And you know, it's changed now though, you know, since probably around 2012, 2013, that obviously the TTO and the Research and Innovation Office have started investing in people like Neil Gordon, who's, you know, he's bridging that divide where he'll give you a hand to write a business plan, and he'll talk to VCs, and he'll go out and figure out who's the best person for you to sit in front of. It's a major positive.
Absolutely.
It's a major thing that Trinity Research and Innovation have changed, and for me anyway, it's worked amazingly. You know?
Well, I'm going to be positive like you in a sense. I mean, from my experience talking to colleagues in other universities, my route through this has been wonderful. There's no question, and the support I've had has been tremendous. I think other universities are much more stifling. And in fact, talking to Matt Cooper, our CEO, Queensland is a different story entirely. Very much more difficult there, and the university is more protective, and there's always someone suspicious of the academic who's trying to pull a fast one in some way, and gain financially and that kind of thing. Whereas here, it's much more facilitated.
To give you an example, we're setting up another company. It's a gene therapy based company for glaucoma, and there's a US-based entrepreneur who wants to do this, and we sort of incentivise them to come to Ireland and set the company up in Ireland, so you can get access to all these initiatives, towards Ireland and IDA. And
is that very useful, by the way? I mean, is the Irish government helpful? I presume we're going to say, we're going to say yes, aren't we? But is that true, really? We've had no money from Enterprise Ireland, I don't think, ever. Maybe Opsona did. Maybe Opsona got 20 grand at the start or something. No, we haven't asked them. I didn't ask them either, I have to say. But is there a good system here from the IDA and Enterprise Ireland mainly, I guess? I suppose it is.
I mean, I think, certainly from our side, like the commercialisation fund, I suppose, that Enterprise Ireland provides is probably kind of a nice standard model for kind of initiating programs like ours, because, particularly, I suppose, for our type of technology, it looks slightly different than maybe the stuff you're working on, where there's years of basic science that have gone in. So, it's easy maybe with all of that work to convince investors that there's something there, whereas for our type of stuff, you need the data that you can get from that commercialisation fund to be able to get to a point where you're investable. So without that, I think it'd be very difficult. I mean, everyone talks about how it's more and more difficult to get early stage money.
Yeah.
And medical devices actually I think is even harder than pharma.
That's not what I've heard. I think it might be that much easier.
No, there's apparently more acquirers
in the
pharmaceutical side of things than the medical device side of things. So investors prefer pharmaceutical companies, but I know truthfully, Enterprise Ireland play a role where I think a lot of our type projects wouldn't exist without them.
Right. Yeah. So that really is important at the start, I guess, to get off the ground. Do you think there's room for a Trinity VC fund in the ecosystem, which we have? Is that a good thing? or how would we encourage that in a way? Because it does seem to be a good thing to me, obviously. We would have our own fund. Do you think, Conor? What do you think? On the Sorova side, for instance, would that be? Is it difficult to achieve?
It is, particularly just I'm sure it's saying in pharmaceuticals or biotech and medical devices, the hurdle is trying to get this first in man. It took us 1.5 years, 2 years to get there. It's still better than other countries, what I've heard, but there still is room. There's room, I think, for more seed funds. That's why the Atlantic Bridge.
Exactly. Well, it strikes me there's not many of them in Ireland. I mean, it's a small activity.
There's not,
And the small that are there are very controlling. Would you agree? What do you make of the VC world? I mean,
in Ireland, I find, if there's anyone here, that very, very risk-averse people for VCs. Everything is too early. It's too early stage. And you're sort of going to them and you're saying, well, we've raised this money to get it de-risked, and we can't do any more pre-clinically. So the next stage is clinical. Go and raise the funds to clinical and then come back to us. It's like, that's what we're asking you for money to do.
Well, so it's a mystery how they make decisions, isn't it? Kind of
I do think it's too small though. The thing in Ireland is that if one VC invests, the likelihood is somebody else is going to want to get involved as well, because they all know each other.
Yes, exactly.
I think it is probably for the more advanced projects that does have a clinical asset, as opposed to all this stuff that we're going to them with a new molecule that might work. Obviously they do invest. They've invested in your company.
Oh, absolutely.
But see, you've got the track record now. I mean, going back with Inflazone, you have the Opsona.
Well, again, it gets back to what I was saying earlier. They give money to the person, really. The project's important, of course, but it's the person as well.
Yeah.
And that's where the academic has to step up in a sense and convince them that academic is going to be able to do this anyway. And that my earlier comment, they fall down because they might like the project, but they go, that person's not going to be able to deliver on this. So that bit of training is what I'm getting at, really, is where we could maybe improve things a bit and encourage our colleagues to do more of this in a sense and prepare them for it. Because again, in my experience, I know this is going to sound, we're all being far too positive suddenly, but I love working with them actually. They're different kind of people to us, obviously, and they've got different motivations and different backgrounds and so on, but they're extremely intelligent. And in general terms, I've loved engaging with them in a sense, and we are supposed to be on the same page. Now, of course, our companies are outside Ireland, all the investors wouldn't be Irish anyway, and that's interesting. And in fact, Citrix doesn't involve any Irish VC, and that's actually quite refreshing as well, by the way. So, but I've always liked to get, and I tell my colleagues, they're good people to work with. They may have different goals, or not so much goals, but different backgrounds and so on, but they're in the same game as us, really, which is great. Okay, let me ask a couple of quick more questions to wrap up, and then we're going to open it to the floor, and feel free to ask any questions. Give us the ambition here now. We'll start with you again, Mel. What do you hope? Give us sort of the 2, 3, 5 year
Yeah, I mean, the
timeline, if it all goes great, and what do you need to do to get there, and what can and again, getting the notion of us helping, in a sense.
So my primary ambition in the short term is to get molecules clinically enabled and get them tested in humans. I mean, getting what you were talking about, that buzz that you get of actually a molecule that you've developed actually going into human clinical trial. Whether it works or not, the fact that you've got to that stage is proof that you can do something in basic research and bring it all the way to translation. So in the short term, that's what it is. Obviously, I would like to see companies succeed and actually go through the phases of clinical trial. But really, I think in the life sciences space we have to be realistic that a lot of the drug development process is not necessarily going to be brought through to the end of phase 3, because that's not necessarily what SMEs do. We develop ideas, get them clinically enabled, get them up to an inflection point that, phase 3 enabling, phase 2 trial data, and then it's acquired by someone. So ultimately, the companies that I'm working with, I would like to see them within a short period of time be acquired by a company that's actually going to go and develop them and turn it into a drug. I mean, ultimately, that's what I would want to see. So
I'm getting to that. I'm asking a commercial question in a way as well, to be honest. I mean, is the vision for you to have an exit in a year or two, or do you see yourself building a massive new pharma company like Elan?
No, I don't see that, and it doesn't necessarily interest me, because that angle of commercialization doesn't interest me. It wouldn't get me out of bed in the morning. What interests me is getting to these inflection points of seeing something work in human clinical trials, because yourself, the difference between a human phase 3 clinical trial and phase 1-2 is night and day. In terms of what goes into it, and the interest for me academically and the intellectually is the early stage, phase 1, phase 2, and so commercially I would like to see exits beyond phase 1 or phase 2.
So you're hoping to be able to get to a phase 2?
Yeah.
And that will require more finance, I imagine, the rest of it, but that's all in.
But I have no problem stepping back from everything beyond phase 2. Once you can get that phase 3 enabling data, I would have no problem.
And then you get acquired.
And then move on to the next thing.
Very good. Lucy, give us your 5-year plan here.
Yeah, so I mean, I suppose our pathway is somewhat similar in that, as a class 3 medical device, as a heart valve implant, truthfully, raising enough capital to take it all the way to market and become profitable, isn't that achievable. Potentially, you could end an IPO.
How much does that? Give us an idea how much that costs anyway.
So 10 million to first in man, probably 100 million to the point where you maybe CE mark approval and I think you might FDA approval. There's a number of companies ahead of us that have achieved 100 million of fundraising and then bust, so they're still not profitable at that point.
10 million to first, that's a lot of money as well, isn't it, to get the first in that?
So
our assumption, medical devices are a bit more straightforward. But
they're not if you go after a heart valve. So so truthfully, we're pragmatic where ultimately we do want to see the device get to market. First, most important milestone is to see it get into patients and have a positive benefit, and then ultimately target an exit, because that is the most commercially viable route. And we're lucky, I suppose, that in the area we're in, and actually in heart valves, there is a precedent of early exit. So you actually get strategic companies acquiring startups when you have 5 to 10 clinical implants. So actually at quite an early stage, because the technology is that differentiating. And then ultimately, I suppose, one of the probably good things about our area in Ireland is actually most of the multinationals all have a strong presence here in this field. So actually you'd look at kind of an acquisition where then there's still an innovation hub kept with that group in Ireland. So you kind of then end up with kind of a partnership ultimately. Do you know what I mean? So you still kind of don't lose the people get completely
and what's the value proposition like? So let's say you have to get 10 million to get it first in man, and then you sell, right? For the investors, is there a major return?
So effectively, if you look at the predicate exits in transcatheter valves, the majority of them were the 300 million, and as I say, probably over 60% happened at first in man stage. There is. It's kind of one of those. I mean, we talk to investors, and it's kind of seen as this sort of binary play where there's going to be a couple of big wins, and then there's going to be a number of unsuccessful companies. But that's the play.
And how can it fall down? You see, because in pharma, it's a different story entirely, as you might imagine, because you've got to get into man, and there could be unwanted effects off target. It's a big challenge. Many fall in phase 3. But in medical devices, is the chance of success higher?
I think there's still always going to be a key learning at the first in man stage. So, we do lots of animal work and we're also doing cadaver work, so you try and learn as much as possible. But I think until you actually put it in the patient, there's still an unknown, and that's why, to Conor's point, this milestone of having clinical implants is so critical to investors, and there is inherently a significant risk before you get to that point. I think at the point where you have, a certain number of clinical cases, then it's de-risked. But no, there still is lots of examples of medical devices that have gone a long way. Still, I think as well, because the commercial requirements, they still might be a viable product, but the commercial requirements from all the clinical trials that are, and that bar is continuing to raise, cost hundreds of millions. So unless, they might actually be a good product, but unless they're going to be good enough to return that, the companies might still acquire it. And, I worked in Medtronic for years, and one of the projects I worked on was where they bought an Israeli startup, and they paid 350 million for that startup, and then spent a number of years developing it with probably a budget of 15 million a year. And then 2 years after, I think, approval, there was another device that was being developed in parallel, and so it wasn't the winner, and ultimately did get cut because it just wasn't commercially viable. So I think that's still, often the case.
Yeah, that's still the risk.
So no, it's still not low risk.
And when you do the trial in Ireland, the clinical trial,
it's an interesting question actually, and we are really trying to explore it. As I said, there's a cardiologist involved in our project, Dr. Martin Glenn, so he actually has a list of patients who he sees who really don't need this device, and he keeps coming to us going, when are we ready to get this into patients, because he's got these little old ladies coming in really crying out for the device. And then, he has colleagues and partners within Ireland who really want to be fair, Ireland actually is getting itself on the map in terms of medical devices, and so there are other cardiologists looking to try and do this work. There's still questions about whether Ireland's more efficient than other geographies, and from our perspective, we need to, that milestone is so important, so we need to... And
the cost as well, I imagine.
I don't think Ireland is as bad, as maybe the US. So we're currently actually looking at a strategy where maybe do a dual path with Canada and Ireland. But I think, for me, I'd love, the more we can do in Ireland, the better, the more we can develop in Ireland, the better, but we still need to make pragmatic decisions about what's the quickest route.
So the model is like, in a sense, you're going to try to get to an exit from, and then give the investors their return and so on. Very good. Conor, what gives your vista?
Like everyone else, I fundamentally want to get that product out there. Be immensely proud to have something new that is helping patients and less side effects and less time in surgery. And then in terms of the company, when I started this, I was kind of thinking, I'd like do something quickly, exit and go on to the next product. And then we're not even clinical trials yet. We have delusions of grandeur. I want to build a big company. The thing is, it's not even my choice anymore. So now the fact that, first of all, the teammates, there's young teammates who now are shareholders, who maybe they want to spend a couple of years learning about a startup, and our investors to the board. So when we get our first mandate next year, and the valuation goes up, there's VC investors, there's angel investors, there's a whole other dynamic there. So it actually isn't to do with the founder anymore. I mean, obviously, we have a say in it, and then there's so many variables as well. So like the first man goes well next year. What's that valuation? Like if a company came in, maybe we'd want to sell, and actually the investors go, no, you can't sell. It's worth doubling down and going on to the next, getting to CE and FDA. So there's so many kind of, there's like game theory, and then there's so many milestones that will inform that decision.
Well, what strikes me for all four of us in a way, the model is exit, isn't it? Like, and you tell people this, and they don't sometimes don't want to hear that. Going, surely you want to build a big company to employ 5,000 people in Mullingar or whatever, And you're going, no, we're not actually about creating employment at all, and that often creates a bit of tension. Do you get that reaction as well?
I think the minute you're developing a product that requires significant VC investment, it drives you towards that exit, because that's how they look at return. So if you can build a product where it's kind of self-funded, and then you get the choices, and you can keep building. But the minute you've taken loads of other people's money, then to Conor's point, they need a return, and the easiest return is an exit or an IPO. I mean, that's the only way they look at it. If you tell them you want to build a business that you want to just create employment, give them a slow return, that's
has it happened in Ireland, Lucy, when like a medical device company did grow into a big company, or was there always an M&A?
I think it's happened for service type, so like you look at, let's say, Craig-Ann or someone like that, you know what I mean? So they were, they've grown and they've had exits, to be fair, but but it's kind of a service-driven business, so there wasn't necessarily, there was a revenue a lot earlier, whereas for a medical device development, I suppose the example would be Nuravi in Galway, which would be a big success story from our side of the world. Now, the model there is still, there's an innovation hub in, so they've been acquired by J&J, but there's still a facility in Galway that's actually, so it's not like the benefit of that. It hasn't exactly. So I think that's maybe the more typical model. I think where there's medical device examples where, say, service and more service type things where they get revenue earlier and then they can build. They're taking loads of capital.
Right. I think it's an important question in a way, because again, given that we are in Trinity, remember, and when we explain to the parents of our students why we're doing this commercialisation thing, say, or we explain to the Irish government why we're doing it, there's different answers, isn't there, in a sense? We're not really about creating employment, which sounds terrible if you're the Irish government potentially, we are about commercial return for our investors. That doesn't sound quite so good for the parents, does it? You know.
Yeah.
So I think it's very important for us to get the message out there that this is actually about education as well, and that we want to help the students, you see, and give a return to the university. That Trinity has part ownership of the companies I'm involved in, and there may be a payback then, you know, and obviously there's fees and from licensing and so on, and then the university can get some money from these things, and then the university can then reinvest. And that's a message I think that we need to get out there as well. I don't know whether you agree, and what the best way to convey that is, because there can be a communication problem with the complexities of this, can't there? You know, as well.
I think what's often missed is, like, you know, the ecstasy is then, okay, the company's bought all this, people get loads of money, and then that doesn't necessarily feed the ecosystem. But I think it's actually the opposite, where when you do have an exit, the whole ecosystem is spawned on by that. All of the investors who've gotten money back put it back in.
Yeah.
The founders often go
Yep.
again. So, you know what I mean? Probably one of the reasons, you know, there's, let's say, examples of those companies that have gone for it, that had an exit, and it's those investors that are prepared to invest in us again. So, you know, that sort of exit thing where it's seen as this bad thing where, you know, everyone
They
gets
take
money
the
and
money
there's no
and run.
positive feedback.
Yeah.
Whereas actually most of that all gets fed back in, and it creates the next round of employment and the next round of employment. So, you know, it's a cyclic thing, you know, and that's
Yeah,
something
somebody did this from Salma, even though we haven't had an exit yet. We've employed 25 people for 13 years, you see, and that's worth X to the economy anyway. Now, the investors don't get anything from that. But for the Irish economy, that's useful, this kind of thing. And I always emphasise that can be seen as a success anyway, in a way. You know, obviously not the big success the investors are looking for, but still. And my last question then, before I open it up to the floor, is related in a sense. Is it Trinity's job then to have one of its primary goals to train the next generation of entrepreneurs? Should that be our mission statement as a university? Matt, I'll ask you first.
I think it's very, very important. Whether it's in a mission statement, I don't know. I do think that entrepreneurship, there is an organic, genetic aspect to some of it. I don't think everyone...
Well, as a geneticist, have you got evidence for this now? If I do the GWAS analysis of entrepreneurship,
I have direct evidence.
is there a gene for
well,
being
here
an
we
entrepreneur?
go. So what you used this evening to register for this meeting was called Tito.
Oh,
Called
yes.
Tito. That's my brother's company.
Now?
Yeah, so there you go. There's proof n equal to 2 people.
Is he an identical twin?
No, your brother. But no, I do think there's an element of it that is natural. That,
Yeah.
You know, it's a personable thing, there's a personality-based trait that you're able to engage with someone. I don't necessarily think that's something that can always be
Would it
taught.
be unpalatable, you see? I'm wondering if we state publicly one of our key missions here is to train entrepreneurs.
It wouldn't be unpalatable.
No.
Absolutely not. No.
I don't think so either, by the way.
I
hear negatives about this.
I wouldn't use the word.
The university shouldn't be doing that. You know, they can do the big, but they shouldn't be doing
I wouldn't
the
use the word train. I would use the word maybe nurture.
Yeah.
Nurture.
Yeah, or encourage.
Encourage on.
Yeah.
Not necessarily training. I mean, training is important to be able to, you know, disseminate information back to students about what an entrepreneur is and you know the topics they should focus on.
Right.
But not necessarily training, nurturing information.
How would you answer, Lucy? Do you think it should be our mission?
I kind of have a similar opinion in terms of, I think, harnessing it. I don't think necessarily it's training, but the more that, like, I think, you know, the ecosystem, once it starts developing, is actually almost self-propelling. So the more that's encouraged and that collaboration is encouraged, then actually it'll kind of self-propagate, and the people who are you know, drawn to it then will find a means of kind of developing that. So I think harness it, and I think, you know, make the most of, you know, the ecosystem and maybe put something around being able to you know expand on it.
Now my answer to any negative on this is the students want it. Some of them, you see, the guy I gave an example. You know, he really wants this. You know, and more of them want it, which is a good sign. I mean, I guess it's the world we live in, by the way. They've all seen the Facebooks and the Amazons and the Googles and all the high-techy stuff, so they're getting more into that, you know. And it's our obligation as a university to respond to what the students want as well, you see. You think, Conor, what's your opinion on this idea that we should have as our mission to train the next generation of entrepreneurs?
I'm not sure mission's too strong.
Maybe train.
But certainly isn't it great that it is to be an entrepreneur, to try and commercialise something, to be self-employed. It is perhaps was a little it had a bad perception, and now it's very, very viable. Now the next thing is there's a bit of hype around the startup world.
Yeah.
I'm a bit worried if every 19-year-old wants to be a CEO. That's a bit depressing as well.
Yes.
So, if it suits some of them, that's great. But this idea that that it is a viable route and it's celebrated and it's respected is great. You know.